Today we're going to talk about the cardiac axis and how to determine the cardiac axis throughout using the ECG, the electrocardiograph. If you remember from last time, we talked about the ECG and we said that the ECG is a 12-lead system. And that we had leads distributed on the body. We had 3 leads which were called augmented voltage leads, so AV. We had AVR on the right arm, AVL on the left arm, and we had AVF, F for foot, on the left foot. And those 3 augmented voltage leads led to the presence of the virtual bipolar leads that form the Einthoven or Einthoven's triangle. So they are the leads that connect between the 3 augmented voltage leads. Like that. We have lead 1 between AVR and AVL, lead 2 between AVR and AVF, and lead 3 between AVL and AVF. And the other 6 leads, so those are 6, and the other 6 leads are found on a horizontal level on the chest to monitor the heart horizontally. We're not going to use those for our lesson today. We're going to use those 6 leads, on the other hand, in order to understand how to determine the cardiac axis. So we're going to plot those leads on a Cartesian product. Now, a very important point to understand is also this graph here is mirrored. It's actually upside down. If you remember, this plotting is a mirror image, so we have the right on the left and the left on the right because the patient is facing you. And when we plot those here, we'll find that this graph is a mirror image. Normally you would have the positive on the upper side and the negative on the lower side. But here we have the negative on the upper side, so this is negative 90 degrees. And here we have positive 90 degrees. 0 and 180. So, first we plot the augmented voltage leads. Their shape would look exactly like they are here. So we have AVF right in the middle at positive 90 degrees. We have AVF. So that vector here is AVF. AVL and AVR are 30 degrees away from the x-axis. So at positive 30 degrees, we have AVL. At negative 30 degrees, we have AVL. And at negative 150 degrees, we have AVR. So those are the augmented voltage leads. And then we have lead 1, 2, and lead 3, the bipolar leads. Lead 1, as you can see, is on the x-axis, so it's going to be here. At 0 degrees, we have lead 1. Lead 2 makes a 60 degrees with lead 1, so lead 2 will be at 60 degrees, positive. That's lead 2. And finally, lead 3 will be on the other side right here from lead 1, also 60 degrees. So 60 degrees from the x-axis, we're going to put it at 120 degrees, positive. This is lead 3. So this is 60 degrees here and that's 60 degrees there. So as you can see, the plotting corresponds to the actual physical distribution of the leads on the human body. The idea of this plotting is that the cardiac axis will be closer to a vector if the summation of the electricity or the voltage is very close to that vector. For example, if the axis is here, let's say at 10 degrees, that means that the cardiac vector is close to lead 1, is very close to lead 1. And it's nearly perpendicular on AVR. And that would mean that the vector is equiphasic. Now, we're gonna know those terms in a moment. Now I'm gonna draw a simple ECG in order to try to obtain its cardiac axis. Now we have a simple ECG. Also, we need to know before we start interpreting the ECG that the normal cardiac axis would be present here. So between negative 30 and positive 90 degrees, the cardiac axis would be normally present. If it's present between negative 30 and negative 90 degrees, this here, we call it left axis deviation. Left axis deviation. If it's between positive 90 and 180 degrees, this one is called right axis deviation. Right axis deviation. This is called LAD, left axis deviation, and here we have RAD. And if it's present right here between negative 90 and 180, is called extreme axis deviation. So EAD, and this is quite rare. This is quite rare. So normally the axis should be present in this part right there. Now, we did not talk about the components of the ECG, the QRS complex, the P wave, the T wave, so on and so forth. This we're going to talk about next time. But the method of today is quite easy, and we'll know and we'll understand how it goes. First of all, we look at a lead which is equiphasic. Here we have AVL. We have AVL. As you can see here, AVL is equiphasic. Equiphasic means that the positive part is quite equal to the negative part. And on the plot here, that means that the vector obtained by AVL is actually perpendicular on it. So the vector is perpendicular on AVL. And then we look at lead 2, which is quite positive here. Lead 2 is quite positive, and this confirms our result. This is the simplest way to obtain the cardiac axis, to look at the equiphasic lead, and then if it's equiphasic, that means that the cardiac vector is perpendicular on it, means that it has a 90 degrees with it, and the cardiac axis would be here, and then you would look at the other leads in order to confirm your results. We have lead 1 here. Lead 1 is positive, so it's in the positive quadrant of lead 1. Lead 2 is quite positive as well. Lead 3, which is here, and that would be also the positive quadrant for lead 3, and it is positive. AVF is positive as well. If it would be negative, it would be on the other side, but it is positive. AVR is negative. If it's positive for AVR, for example, it will be on this side, not here, but it is here, and we can see that AVR is negative. So all of the leads confirm our interpretation. What if there's no equiphasic lead? You look at the most equiphasic lead. For example, if AVL looks something like this. Well, it's kind of equiphasic, not pretty much, but you'll see if the positive is more than the negative in the equiphasic, in the nearly equiphasic lead, what you do is that you're gonna move this vector closer to your lead. So we have AVL here, and the positive is a bit more than the negative, so you move the vector, let's say 15 degrees. So at 45 degrees, you will move your vector closer to AVL. So you go from 15 degrees, you get 45 degrees, and that will be your estimated cardiac vector. On the other hand, if the vector is more negative than positive, for example, it looks something like this, then you will move it away from your lead 15 degrees. So perpendicular would be 60 degrees, you move it 15 degrees more, and it will be at 75 degrees. And that would be your estimated cardiac axis. So that was our lesson for today. I hope this method is easy and you understand how it works. Next time we're going to talk about the components of the ECG readings, P wave, the QRS complex, the T wave, and so on and so forth. Until next time, I thank you for watching and see you.